Every single day, people just like you, I mean babies, children, adults, and even the elderly, are given medications they don't even need. No tests, no proper diagnosis, just a quick sale. This isn't just irresponsible, it is dangerous. Imagine walking into a clinic with a mild fever, a common cold, or even a minor stomach upset, and being handed strong antibiotics, painkillers, or even unnecessary drugs, all because someone wants to boost sales. It's happening right now everywhere. Hi, my name is Nicholas, and I'm a pharmacy practitioner. Welcome to Meded Pharmacist in Focus. This is where we talk about medications, healthcare, and any other essential topics that may arise. So today, we need to talk about greed in healthcare because it is costing people their health. A worried mother recently told me that her baby developed a cough and fever. Like any caring parent, she requested her husband to run to a nearby pharmacy to consult. And guess what happened? Without any test, without any proper diagnosis, the pharmacist handed him a strong antibiotic. Just like that, no questions asked. What if the fever was viral and not bacterial? What if this leads to antibiotic resistance, making future infection harder to treat? What if the side effects cause more harm than good? This is not just irresponsible, it is a betrayal of patients' trust. But let me take you deeper. Let me tell you about something that shook me to my core. I once worked for a doctor, someone who had taken an oath to treat and protect. But instead of prioritizing patients, he bragged about prescribing strong antibiotics and unnecessary medication to every patient just to boost sales. I looked at him in shock. How could someone who sought to do no harm proudly exploit sick people? And guess what? I didn't even finish a month in that clinic. I refused to be part of that greed driven system. This isn't just about one doctor. It is a widespread issue from pharmacies to hospitals to private clinics. Too many healthcare professionals are choosing profits over people. To every parent, patient, and caregiver watching this, be careful. Not every fever means infection. Antibiotics do not treat viruses like the flu or common cold. Taking the wrong medication can cause more harm than good. Your health is not a business transaction. So, before you take any medications, please ask why it is being prescribed. Number two, demand tests when necessary. And number three, if something feels wrong, get a second opinion. And to my fellow pharmacy practitioners, doctors, and healthcare providers, what are we doing? Have we really fallen this far? When did our profession become about sales instead of saving lives? Will you give your own baby unnecessary antibiotic? Will you prescribe something to your own mother just to make money? If not, then why do it to someone else's loved one? We swore an oath. We promise to protect our patients. If we lose our integrity, we lose everything. And to health authorities and regulators, where are you? How are we still allowing profit-driven sales to come before patient safety? This is all we need from you. Number one, we need stronger regulation to prevent reckless prescriptions. Number two, we need strict penalties for medical professionals who prioritize money over patients' well-being. Number three, all we need from you is public awareness so patients know their rights and when to say no. So patients, be informed, ask questions, and never take medications blindly. To pharmacists and doctors, uphold your oath and prioritize patients above all else. To health authorities, again, step up and enforce strict regulations against reckless prescriptions. If you agree that patient safety should come first, share this video, okay? Let's hold pharmacy professionals and doctors accountable and demand better healthcare for everyone. I mean literally everyone. Thank you, and I'll see you in the next video. Stay informed and stay safe. Bye-bye.